Welcome to Med in 5. The goal of our channel is to simplify medical concepts and help you understand them hitchlessly. Today, we're covering human herpes viruses that can produce strep throat-like symptoms. Try these cues before we start. Which herpes virus causes Burkitt lymphoma and nasopharyngeal carcinoma? Which one gives owl's eye inclusion bodies under the microscope? What antivirals are used against strep-mimicking HHVs? Stick around. HHVs are enveloped, double-stranded DNA viruses that replicate in the host cell nucleus. They establish lifelong latency after the first infection and can reactivate when immunity drops. The HHVs we're covering today cause strep throat-like symptoms and become dormant in immune cells afterward. First is HHV4, aka Epstein-Barr virus, which typically causes infectious mononucleosis in teens and young adults. It's frequently called the kissing disease because it spreads through saliva, often after close contact like kissing or sharing utensils or drinks. Symptoms include sore throat, fever, fatigue, swollen lymph nodes, and an enlarged spleen. Most patients recover in 2 to 4 weeks, but fatigue can linger for months. EBV primarily infects B lymphocytes via the CD21 receptor, where it becomes latent. EBV's LMP1 protein mimics human immune signaling and drives cell proliferation, allowing it to stay hidden long-term. EBV can reactivate and cause serious disease in the immunosuppressed. Transplant patients may develop post-transplant lymphoproliferative disorder, which affects lymphatic tissue throughout the body. Infected B cells multiply uncontrollably, causing fever, weight loss, and lymphatic overgrowth in various organs. People with HIV may develop oral hairy leukoplakia with painless, white, corrugated patches on the sides of the tongue that can't be scraped off. Lab tests are often needed to differentiate EBV from strep throat. Blood smear often shows atypical lymphocytes, which are reactive CD8+ T cells responding to infected B cells. The Monospot test detects heterophile antibodies, or antibodies that react with antigens from non-human species. Serology confirms the diagnosis. PCR can be used in complex or unclear cases. Treatment is mostly supportive, with rest, fluids, and antipyretics. Patients must avoid contact sports for a few weeks as a precaution against splenic rupture. Corticosteroids may help in cases of severe tonsillar swelling or airway obstruction. Most people recover well from EBV infection, but the virus is linked to several cancers, including Burkitt lymphoma, Hodgkin lymphoma, NPCA, and certain gastric cancers. Next is HHV5, or Cytomegalovirus, which often causes a monospot negative mononucleosis-like illness in healthy people, marked by fever, fatigue, sore throat, and swollen lymph nodes. It's transmitted through body fluids, like saliva, urine, semen, and breast milk, as well as via the placenta and organ transplants. CMV mainly affects immunosuppressed patients and newborns. Infections in the general population are often asymptomatic. The timeline of illness varies. Some infections are silent for years, while others are detected shortly after birth or during reactivation. CMV becomes latent in monocytes, macrophages, and bone marrow progenitor cells after infection. It evades immune detection by suppressing MHC1, which normally alerts cytotoxic T cells about viral proteins, and producing an analog of interleukin-10, a cytokine that blocks immune activation. In people with AIDS, CMV may reactivate as retinitis, causing vision loss. Esophagitis or colitis may also arise. Congenital CMV may present with sensorineural hearing loss, paraventricular calcifications, microcephaly, and neurodevelopmental delays. Transplant recipients face a great risk of serious systemic disease. Diagnosis involves PCR, viral culture, serologic tests, or detection of CMV proteins in blood. Examination of infected tissues may reveal owl's eye intranuclear inclusions. Treatment includes ganciclovir or valganciclovir. Foscarnet is used for resistant strains. compared to EBV. CMV has weaker associations with cancer. Neither virus has a licensed vaccine, so prevention relies on practical habits like good hygiene and avoiding contact with infected body fluids. Screening donors and recipients for CMV minimizes transmission during transplants. Let's review. Which herpes virus causes Burkitt lymphoma and NPCA? Answer: EBV. Which one gives owl's eye inclusions? Answer: CMV. What antivirals are used against strep-mimicking HHVs? CMV may be treated with ganciclovir, valganciclovir, or foscarnet. EBV needs no antiviral. Nailed all questions? Epic! If this vid helped you, hit like, share, and subscribe. Download the comparison table from the link in the description. Thanks for watching.